So the state legislature decided to look at Medicaid costs and how to lower them in Colorado. And of course, they needed a dissenting view. What's better than our own Linda Gorman at the Independence Institute? Linda, thank you for being here.
Thanks for having me.
All right, so what was the purpose of this commission you were part of that was put together by the state legislature?
The idea was to find ways to reduce healthcare costs in Colorado. So it was supposed to be everything, not just Medicaid, but of course people mostly think about Medicaid when they're from the government and they're here to help.
So the idea of making costs go down,
yes.
Things like don't do the Medicaid expansion, allow cash for care, those type of things I'm sure is what they looked for.
Well, the expansion was off the table and Obamacare was off the table to some extent.
What do you mean it was off the table? Colorado has increased our Medicaid rolls by nearly 400%. One out of every 4 Coloradans is getting welfare for health care. Mm-hmm. How can that be off the table?
Because it helps so many people.
She says with a straight face. Able-bodied working men are getting Medicaid.
Yes, they are.
And tell me if I'm wrong here. Medicaid was designed for people who did not have the means or could not get coverage elsewhere, right?
Yeah, and very poor people who couldn't help themselves. And so the program is, on paper, the most comprehensive health care program in the country, maybe the world. It covers everything: dental, medical, nursing home, eyeglasses, over-the-counter medications, transportation, everything. The problem is when you take this and you then expand it to able-bodied people, all of a sudden you've got a small number of disabled people who are spending 45% of the budget, and then you've got all these healthy kids and healthy adults who are lots of people, lots of voters, but not much of the budget. So when legislatures, any legislature, starts looking at this, they say, we've got to cut that spending for the disabled. So it changes the focus of the program from people who are severely disabled and really, really need help to now they've rebranded themselves. They're calling themselves Health First Colorado, and they want to think of themselves as the premier insurer in Colorado. It's not insurance, it's coverage.
It's coverage and it's governmental. And I've got a rooster in this fight because my son is disabled. He has Down syndrome. It took 3-4 years to get Medicaid, to get him onto the roll. So we were on this huge waiting list for the first several years of his life, which, by the way, are the most important when it comes to a lot of this developmental issues he has and healthcare issues. And to find that people who are healthy, who make plenty of money, now get the same coverage that he does, what you're telling me is because this covers everything. Transportation. My insurance company doesn't cover my transportation, doesn't cover my eyeglasses, doesn't cover my dental, but all this is covered. We're giving this now to healthy working people, and so when the costs go down, it's going to be people like my son and other disabled people whose services will be cut because everybody's services will be cut. Do I understand that?
Well, the goal of the commission was to actually reduce costs, to do things in a more efficient way, not necessarily cut expenditure. And I think that's a distinction that people often forget, that expenditures are not the same as costs. Because in medicine, particularly, the prices don't mean much. And so you can't just say price times quantity equals cost, because maybe you've got a really low Medicaid reimbursement rate, but the state is shoveling huge grants into something on the other side. So just because it's paying $17 for something doesn't mean the cost of the service is $17. But you're right, in terms of you've now got to fight over resources, because money is limited. You can't just expand it forever.
Wait. Money is
limited, I know.
Limited.
Yeah.
I didn't know that.
Yeah.
So what did this commission conclude? And you dissented. Well, let's start with the conclusion. What did they conclude, and what did you disagree with?
There are 3 reports. I got to say, one of the interesting things about this commission was it had people from all parts of the healthcare sector. It had somebody who headed up an insurance company. It had somebody who had employer plans. It had people that were in state government. And so you get a lot of different perspectives, which is useful when you're trying to understand something. But amazing things happen when people are put into a group. And the commission produced 3 reports, and I wasn't going to write a dissent until the last report draft came out. And one of the recommendations was we can cut health care costs in Colorado by having universal preschool for everybody who's Medicaid eligible.
So I'm sorry, and I'm not all that bright, but the idea was
You would have been brighter if you'd gone to preschool.
If we spend more money in education, we're going to save money in health care.
Yes.
Because explain that to me.
The theory is that if you're better schooled and your cognitive abilities are developed, then you'll make better choices later on in life. The evidence for this is slim. The evidence for this is very slim. Now, my perspective on this is, okay, if you make this recommendation, then your responsibility to the legislature is to give all of the evidence we have for this proposal and all of the evidence we have against this proposal, and then let's talk about it. That's not what the final report did in a number of cases. All it did was cite 2 very old studies in favor of this when there are other studies saying, no, we shouldn't do this. And these have been more recent and much wider scale. They don't see any cognitive improvement. So I just look at this and say, we can do better.
This is part of the frustration I have in that when it comes to these commissions, and they're everywhere. Every local government has boards and commissions. My hometown of Boulder has 23 different boards and commissions, all that have real power, that are appointed positions. From the liquor board to the energy board to the sustainability board to the zoning board. And I wonder who gets involved in these. And it's usually one of two folks. One, financially interested people. That is, there's a crony aspect that, if you're going to be on the zoning board because you're the architect in town, and boy, that makes a lot of difference, and you say that all things have to have this requirement, it helps your industry. But there's also this group of people who just love to tell other people how to live because they are smart and they want to spread that. When it comes to limited government folks, we don't do subcommittee meetings. We don't do commissions. We're raising our kids. We're working. We don't do that. For us, it is maddening, and therefore we don't show up. You're one of the few who show up to these things. I can't imagine how much they hate you to begin with. But are these things predetermined from the beginning? My days at RTD made it really clear. These neighborhood meetings, let's go out and find out what the voters and taxpayers think.
Listening tours.
The listening tours. They're Potemkin villages. They listen to what's going to happen because people who come out are only the people who want more of what the government's doing.
That's interesting. I think to some extent that's true, although we did have a couple of meetings up, one in Grand Junction and then also in Frisco, that were very interesting because people were really angry. And mostly they were angry about what Obamacare had been doing to their insurance premiums, which you'd never tell from the final report of the commission because it said Obamacare was great because it had achieved more coverage. It didn't talk about the fact that, we were dying out here with our insurance premiums doubling.
And there's a difference between coverage and treatment,
actually
right?
Getting medical care, you think?
Yeah.
Yeah. And the other thing that they were saying, and which goes to your point, which is that Medicaid specialty care was virtually unobtainable. And you wouldn't know this from reading reports from the department or something like that. You've got to talk to people. So that was helpful. But in general, I think you're right. You're not going to sit through this for years unless you have a dog in the fight. What
comes from all the work that you and this commission have done? Now with a ridiculous recommendation with only one side of the argument done, which is, will your dissent be part of the report that is published? It is.
It is in an appendix. I did something similar with a couple of other people for the Blue Ribbon Commission in 2007, and that dissent has vanished from the public record. So that's why I published it independently at the Independence Institute site.
I didn't know this. So
I asked somebody actually I haven't paid attention. Somebody contacted me and said, "Do you have a copy? Because I can't find it anywhere."
Because the government has the report, but not your dissent.
I guess I didn't even check.
Fascinating.
What they do with this, these are legislative blueprints for the people who are interested in these kinds of reforms. And in this case, it's more centralized control by the state of your health care. Price controls, workforce controls, and so forth. And so these now become an official recommendation, and they can use it to the legislature, and they can say, you should do this. And then in this case, they went back to the first report was all about the 2007 commission saying, we've accomplished these things. And so these are dangerous, and they need to be seen very clearly. And I think a better approach for the legislature might be to use a red team, blue team approach when you have an ideologically divided issue.
You have one group put out their recommendation and another group put out
and
their
they
recommendation.
attack one another, you know, and you wade through it that way rather than having some central committee of who knows who, have meetings that nobody attends, and then they develop the agenda.
Interesting. Hey, we've only got about a minute and a half left. Let me steer it to what's going on nationwide. Stalling in Washington. Obamacare is failing, and failing huge. We're looking at some 27% insurance increases. What's the solution? Talk about Colorado first. What should Colorado do? If you could get the legislature to do anything, what would it be?
Tell Congress to repeal Obamacare. I mean, there's really not much a state can do within the Obamacare limits.
They don't have to expand Medicaid, can't they?
We have expanded Medicaid, yes.
Can't they reverse that? I'm not talking. I'm not
yes.
talking politically
yes,
possible.
They can.
I'm just
it's
talking.
legal. It's legal to cut Medicaid, and in fact, one state, Tennessee, in 2005, did it, and the sky did not fall. They did it because the state was going bankrupt, and they had no other choice. And it actually increased the number of people who worked, and increased the number of people with private health insurance. So, reducing Medicaid rolls is within the realm of possibility, and it's legal.
What is it you want Congress to do?
I want Congress to repeal Obamacare, and I want Congress, you know, to
replace it with anything, or just repeal it?
Just repeal it. And then there are some things that the states can do. Colorado functioned really well with a high-risk pool, and the federal government could fund those. Colorado had good insurance regulations, and then Colorado needs to decide what it wants to do about Medicaid. One thing the federal government needs to do, though, is stop matching things like Medicaid provider taxes. Just because a state puts a tax on doesn't mean I should have to pay.
Linda, thank you. Get all that information at independenceinstitute.org. Tell a friend, and we'll see you next week.